بسم الله الرحمن الرحيم. الفلاين لوكيميا فيروس. Feline leukemia virus remains one of the most important infectious diseases of cats globally, worldwide. It manifests primarily through profound anemia, malignancies, and immunosuppression, and infects domestic cats and other species of the Feline, عائلة القطط. الفلاين لوكيميا فيروس ده ريترو فيروس من العيلة اللي هي أونكوفيريني، زي الفلاين ساركوما فيروس، mouse leukemia virus, and 2 human T lymphotropic viruses. Although oncogenesis is one of their more dramatic effects, oncoviruses cause many other conditions, including degenerative, proliferative, and immunologic disorders. في 4 feline leukemia virus subgroups. Almost all naturally infected cats are originally infected by feline leukemia virus type A. وده الأوريجينال archetypical form of the virus. في additional mutated forms حصل فيها طفرة of the original feline leukemia virus A subtypes as well as the feline leukemia virus B و C و T. الفيلاين لوكيميا فيروس بيزود الفريكونسي of neoplastic diseases. It's strongly associated with development of erythroid hypoplasia and consequent severe anemia. It has the propensity to infect and destroy T lymphocytes, leading to lymphoid depletion and immunodeficiency. فلو انت خدت عين الدم وعملت CBC هتلاقي ايه بقى في التي lymphocytes. الفيروسز بتاع السب جروبس الأربعة are detected but cannot be distinguished by commonly used diagnostic test kits. مش هتقدر تفرق إذا كان ده A ولا B. Persistently infected healthy cats serve as reservoir for leukemia virus for both vertical and horizontal viral transmission. vertical من الأم لأولادها والhorizontal اللي هو في الجروب نفسه. الأورونيزال contact with infectious saliva أو urine most likely mode of the horizontal transmission. لو أنت في group of cats السلايفا واليورين هم أكتر حاجة بينقلوا العدوى ما بين المجموعة. الفيرتيكال ترانسميشن بيحصل نتيجة الحملة أو النيرسينج كمان الرضاعة. الإيتيولوجي والإبديميولوجي tears and feces may contain virus but are not considered to be clinically significant in disease transmission or diagnostic detection. Although direct contact, mutual grooming, shared litter trays, litter box الواحد اللي كلهم بيتشاركوا فيه, food dishes are the primary methods of horizontal transmission infection through bite wounds if possible. عشان كده لو تفتكروا احنا في الكيس ماجمنت قلنا الكيجز بتاعتك ولازم تتطهر ولازم تتنقى وهكذا. It's considered to be an age-dependent disease. اليونج kittens طبعا في high risk to progress the infection. whereas adults display some degree of age resistance. كل ما الحيوان كبر كل ما كانت مقاومته أعلى. However, transmission can occur at any age, and factors affecting clinical course of disease are complex and incompletely understood. لغاية دلوقتي محدش قادر يفهمها 100%. Pathogenesis. After oronasal inoculation, the virus first replicates in the oropharyngeal lymphoid tissue. امسك يا معلم، دخل lymphoid tissue. From there, من هنا بقى, the virus is carried in the blood mononuclear cells, the spleen, the lymph nodes, the epithelial cells of the intestine and bladder, salivary glands, and the bone marrow. داخل بيتشعب بقى في كل حاجة. The virus also appears in secretions and excretions of these tissues and in peripheral blood leukocytes and platelets. ده داخل على كل حاجة. الفيريميا is usually evident من 2 ل 4 أسابيع after the infection. The acute stage of feline leukemia virus infection occurring 2 to 6 weeks after infection is rarely detected, but typically characterized by هتشوف ايه؟ mild fever, malaise, lymphadenopathy, and cytopenias. Cats unable to mount an adequate immune response become persistently viremic and develop a progressive infection, often leading to fatal death. ايه الديسوردرز اللي هنشوفها؟ anemia, neoplasia, immunosuppression, immune mediated disease هتبقى تظهر بقى، reproductive problems, enteritis, neurologic dysfunction, stomatitis كمان. 3 types of tests are now readily available for clinical use. Immunochromatography زي الإليزا, immunofluorescent زي IFA والPCR. Virus isolation is considered the gold standard diagnostic test, but is not generally available to private practitioners. ركز في symptoms, signs, والhistory. ELISA or other point of care antigen test kits can be used in the veterinary clinic to detect the presence of the soluble feline leukemia virus P27 antigen in the whole blood or serum using a lateral flow test kit or a multi-well plate. Saliva and tears are not considered to be reliable samples for testing purposes. Several different test kits are available. Most have sensitive and specificities of 98% عشان تقدر تقول إن ده feline leukemia virus. Unfortunately, no curative treatment currently exists to eradicate retroviral infection. Reports of various antiviral and immunotherapeutic agents to reverse viremia, improve clinical signs, and prolong survival are abundant. Some feline leukemia virus positive cats can live without major disease complications for years with routine prophylactic care, good husbandry, minimal stress, and avoidance of secondary infection. Infected cats should be kept strictly indoors to reduce the risk of exposure to infectious agents and to prevent the transmission of the virus to other cats. Routine vaccination should be administered based on the individual risk assessment and in compliance with the local laws. The use of inactivated vaccines should be considered because of the concerns regarding use of live vaccines preventing to virulence in immunocompromised animals, although this doesn't appear to be common. The feline leukemia virus vaccination should not be administered because there is no evidence to suggest a benefit after infection. هو خلاص القط خد العدوى، هتدي الفاكسين دلوقتي تعمل بيه ايه؟ Physical examination focusing on the external parasites, skin infection, dental disease, lymph node size, body weight should be performed semi-annually كل 6 شهور مرة, along with a routine program for parasite control, annual fecal CBC, chemistry panel, and urine analysis tests. لازم الحيوان عنده حاجة زي دي لازم هتكيب him safe لأن أنت عارف إن هو عنده إيه feline leukemia virus. All infected cats should be neutered طبعا عشان ما تنقلش. Owners should be advised to watch for signs of related disease, particularly secondary infection. Although feline leukemia virus positive cats often respond well to treatment, therapy for such infection or other illnesses should be early and aggressive because of the immunocompromised situation. عشان الفيلاين لوكيميا فيروس ده تاريخيا associated with rapid and grave disease, modern prognosis varies considerably depending on the husbandry, veterinary care, and individual immune system variations. Large-scale studies have demonstrated an average survival of 2.4 years after diagnosis among positive cats, versus 6 years after testing of negative control cats. يعني ممكن يعيش لغاية 2 و4 شهور تقريبا. 50% mortality in the 2-year and 80% mortality by 3 years after diagnosis. طبعا الكيتنز بتتأثر أكتر بكتير جدا while the adult remain healthy for many years. ممكن تستعمل الليمفوما treatment طبعا. Feline lymphoma can be treated with cytotoxic agents, drugs, may cause significant toxicities if not dosed and administered properly. Most of the cytotoxic drugs are also carcinogenic, must be handled properly. Before administering these drugs, veterinarians should familiarize themselves with proper dosing and administration procedures. Appropriate monitoring طبعا of the patient, toxicities and complications, and safe handling to prevent exposure of veterinary personnel and owners to the agents and their metabolites. حوالي 50% من الcats with lymphoma that are treated obtain a complete remission defined as no clinical evidence of the disease. And negative cats that attain complete remission live in an average of 9 months, whereas survival among feline leukemia virus positive cats average for 6 months. Cats are not treated أو ما استجابتش للعلاج بتسرفايف من 2 ل6 أسابيع ماكسيموم. في بروتوكولات كتير جدا للعلاج، منهم واحد مشهور قوي بروتوكول consists of an intensive induction phase. بستعمله الفينكريستين weekly لمدة 4 أسابيع. cyclophosphamide every 3 weeks في نفس اليوم اللي بتدي فيه الفينكريستين. بريدنيزولون daily. متبوع بالمرحلة الثانية من العلاج less intensive maintenance phase من نفس الأدوية لمدة 3 أسابيع، ونفس الموضوع البريدنيزولون بيبقى يوميا. Treatment is continued for around 1 year. البروتوكول ده حقق لي 79% of the cats attained remission and average survival was 150 days later on. Changing the maintenance protocol، اتغيروا بقى بالدوكسوروبوسين كل 3 أسابيع، وده بيدي لك ريميشن لحوالي 200 يوم أو 280 يوم. When relapse occurs, the drug regimen can be changed and second remission achieved. However, second remissions seldom, rarely يعني قل ما last as long as the first one. To avoid all of this, we have to vaccinate the cats regularly. Thank you.